Wow, this is great. My kids are going to be very jealous. See, I don't know a lot about football, but they do, and so now I can tell them that I have a souvenir. Thank you, David. I appreciate it. You know, we are thrilled to be here and to be here with all of you to co-host the 2024 5th Zero Suicide International Summit. And I want to welcome you all to Liverpool on behalf of the entire Mercy Care team. I've been just so thankful to be able to work in partnership with Elaine and Joe and their entire team to be able to put this together in such a short time, really, but what feels like forever, but such a short time. So we do want to especially thank David for his leadership, for shepherding us all of these years to where we are now, to bringing people together, to having the courage to bring people together from 20 countries in Rotterdam for the first time, where we really declared that zero suicide was a global effort. It wasn't going to be just a US thing or a UK thing. It was going to be an entire global effort. And that in order to be successful globally, we need to work together to make that happen. So I want to thank David, particularly including RI, Behavioral Health Link, and their entire team for getting us to where we are, and we are so humbled and thankful to be able to take this opportunity forward. But in order to do so, we're going to need to work together with all of you. I want to thank every single one of you for coming today and for your commitment to doing something courageous, heroic, audacious, something that nobody thinks is possible. 20 plus years ago, when you said, we're going to eliminate suicide, and people said, there's no way that's happening. And they still say that today, except for that we actually had no suicides in our entire system for 18 months and proved that it is possible. So I want to thank all of you here today. So this is our new leadership team. Dr. Kathy Frank cannot be here today. She had a family emergency and wasn't able to travel at the last minute, but is one of our incredible leaders, as you heard, many of you heard me talk about last night. John Zervos here is the head of our global health programs at Henry Ford and has just been an incredible partner, helping us really think about how we partner all over the world to really make this work happen. Thank all of our partners, of course, the Hines, Kevin and Margaret, who are just such great supporters of this initiative, the entire Mercy Care team, Zero Suicide Alliance. You see all the banners outside, RI and Sue's team in Australia. I can't find Sue, but she's around here somewhere. There she is. And Sue has been obviously instrumental in making this happen moving forward. All of our sponsors, I mentioned them before, but also want to especially thank Benson Ford, who at Henry Ford has been a big supporter of our mental health and suicide prevention programs for a long time and continues to support us moving forward, along with AFSP, the National Council, Clear, Concert Health, Centerstone, and CARP, all really great sponsors of the event. So the theme, You'll Never Walk Alone, right here, is obviously inspired by the Liverpool Football Club. And the team, the entire team, so if you've never been to a Liverpool match, they adopted this song and they sing it before every single game. And it really was a special significance after people died, lost their lives in disaster a long time ago. And they've been singing this song every single game since. It's a perfect theme to fit with this this summit. The lyrics are right outside the stadium in Anfield, so if you get a chance to take a tour, you'll be able to see them right on the crest. And of course, it's been an inspiration for all of the football club moving forward with their matches. I want to talk a little bit about our agenda. So today, you'll see throughout the 2 days of the summit that we're going to have this moving from what we've accomplished over these last 10 years to what's happening now and to what's going to happen in the future. Thinking about moving from celebrating our past and our accomplishments, but recognizing that there is a lot of work to do and that to do it, we need to work together. What are the things we're doing now, and how can we move together forward with some innovative approaches and partnering in new places that we haven't done before? Today we're going to talk about some of our more recent data from our big research program in the US, as well as the work in Australia, implementation science strategies. We have a special panel, my very favorite, I have to say, which is several representatives from across Asia, from low and middle income countries, who are going to talk about how we can take the next step in this work, focusing on the workforce as well. We are talking tomorrow about national strategies, lived experience, AI and machine learning, and we're really going to talk about how clinical services transcend, and also focusing on funding and investment in zero suicide. So why are we doing this? We are here because long ago, 25 years ago, almost 25 years ago, and Dorianne is here. She was part of that very first group. I mentioned this quickly last night, but we had an original team called the Blues Busters who took the risk at Henry Ford to say, we want to develop a utopian healthcare system for people with depression at the time. It was called Perfect Depression Care. But when we were challenged that our outcome of improving depression severity, reducing readmissions, all the same things that everybody does, wasn't good enough, we were challenged, and that team went back to the drawing board, brought a bunch of people together, and it was a nurse who stood up in that room and said, if we want a perfect program, if we want a perfect vision, then we want to really have a perfect outcome for people in our care, then we have to have no suicides. And that was bold. We had people leave the system, but courageously, our health system decided to pursue that moving forward. After 1 year, we reduced our suicide rate by more than 75%. We've sustained that for over 20 years now, 23 years. And we have the lowest suicide attempt rate of any health system that publicly reports their data in the United States right now. But that wasn't the beginning, because lots of people started joining what we were starting to call zero suicide, what our zero suicide outcome. And a lot of people started galvanizing around that message and that program, led by a movement across the US, in the United States, and the movement across the international community that we just talked about from David. We also have groundbreaking research that we're going to share with you momentarily. So there is no other, we've been saying this at every single summit, but you have to go for zero because there's no other acceptable number. What if we said 5% reduction or 10% reduction, and then we pat ourselves on the back when 90% of the people are still dying? There is no reason for us to not believe that we should strive to try and prevent every single person from dying by suicide. We may not get there, but because I've seen it, I know that we can get there, and we have to just work together to make it happen. It's going to be hard. We're going to struggle, but we need to do it, and we need to do it together, because we have an opportunity to make a real difference in this world. And I'm thankful that all of you are here to do that with us. And we have an opportunity to shift a paradigm and make something spectacular happen. So thank you all for being here. I look forward to this 2 days. I'm so energized and excited to be here with all of you. You saw the next slide, and I just want to introduce a very special message from His Royal Highness the Prince of Wales, Prince William, who has a special message for all of us here today for our summit. So if we can
Thank you for inviting me to join you today. I'm so sorry I can't be there in person, but I hope you'll allow me to say a few words, albeit virtually. Suicide prevention is an issue which I hold very close to my heart, and I'm delighted that today's summit is being held here in the UK for the first time. Sadly, I have seen and felt the impact of suicide firsthand. My first call out as a pilot for the East Anglia Air Ambulance was to a suicide. My memory of that call out is as clear as if it was yesterday. Devastatingly, 700,000 people die by suicide across the world every year, and 6,000 of those are in the UK. The evidence suggests that mental ill health is a more pressing problem than ever before. 1 in 5 of us will experience suicidal thoughts over our lifetime. That is why this year's summit is so important, and by coming together today, I hope that you are able to share best practice and discuss how support and attention can be mobilised across the globe. Initiatives such as the Zero Suicide Alliance help highlight how we can all support suicide awareness and prevention. Nearly 2.7 million people have accessed its suicide prevention training. Here in Liverpool, Merseycare NHS Foundation Trust is actively working to seek out new ways to prevent mental health crises. I have visited many suicide prevention and support services over the years, including the innovative Life Rooms in Liverpool back in 2017, and more recently, James's Place Sanctuaries, which also began life here and are now being rolled out across the country. I'm immensely proud of the UK's role in helping advance suicide prevention techniques, which are shared around the world. We're all extremely grateful for your commitment to such an important cause, and I hope this summit, with all the ideas and expertise within it, can make real strides towards eliminating suicide. Thank you.
Clearly, there is some incredible support across the UK for this work, and I'm so thankful to now introduce another huge supporter of this work, the Mayor of Liverpool, Steve Rotheram, who is going to deliver some remarks. Thank you so much.